bites and stings from reptiles, animals, arthropods, insects. We all need to be aware of the surroundings and environment that you are particularly employed or training in. They become familiar with these types of animals, insects, and reptiles, so that you are well educated on what to do. So this is just a general overview of bites and stings. Here we're seeing more of a snake bite. There are two puncture wounds. For the EMS professional, we want to be able to identify the coloring and markings of this snake, as well as potentially the elliptical or eye pattern. And unless you're very familiar with the types of snakes, it's going to be very hard then to recognize. And so this is the way that we're going to recognize whether they're venomous or non-venomous, is by again the coloring scheme of the snake, as well as the elliptical eye pattern. Now we got to worry that when we look at these puncture wounds, how much venom was injected in. Multiple bites would mean that there might have been multiple injections of venom. And we want to look at the time at which this the person was bitten, as well as the activity that they're doing, because it takes into account as to how much of this venom may now be circulating throughout the bloodstream, and whether or not this directly was envenomated directly into some kind of bloodstream, like a vein or artery, versus just into localized tissue. The bite and puncture marks that we can see here, there's some erythema or redness, and they're around the two puncture wounds, and we can see that discoloration sort of is around those bite marks. We'd want to note and mark and watch this redness start to expand over time. We'll talk about specific treatments in the past. We would definitely are trying to recognize the coloring and markings of the snake, and then to call ahead and identify the antivenom that is required. Any part of the body is liable to be exposed enough to a bite. Usually it's at the lower extremities, because we're walking around, they're kind of exposed and we're unaware that there's a snake in the area. In this case, this person might have been reaching for it, but they're showing you a snake bite to the fingers. A lot of vascular, highly vascular tissue, a lot of capillaries there, a lot of nerve endings. I suspect it would be quite painful. Again, you notice how red this is getting and how inflamed or edematous now is developing. And again, we'd look for the markings, elliptical eye patterns, and try to get the antivenom for this patient, at least call ahead. We'd like to restrict any movement so that it doesn't start to stimulate blood flow to that area and then cause the spreading of the venomation. Here's another type of bite. This one is a recluse spider, and you notice the erythema, the edema, and that blister that seems to be forming right there in the middle. Now, most snakes have venom that is a neurotoxin, so it's going to cause the person to have this type of neurological deficits, dealing with the brain and spinal cord. So when you look at people having problems with their respiratory rate, seizures, and coma, this may also affect the central nervous system as well as the cardiovascular system, causing respiratory and cardiovascular compromise. Now, when you look at other insects, such as this brown recluse spider, it causes more of a necrotizing and less of a neurotoxin, but more of a necrotizing type of damage. And so what we're seeing here is this localized damage to all the cells and that tissue just in this extremity. All of this will start to die off after the envenomation. As far as our identification, and sometimes because these insects are so small, we're unable to actually see or capture or identify what was bitten until several hours and maybe even days later. So we definitely try to use our history of present illness to flush out what were you doing at the time, what's in the particular area of the place that you were bitten, what was the likelihood of what type of insect, spider, animal, or a reptile